Hello, everyone, and welcome back to From Hello to Help, our podcast series where we explore the essential resources that keep our communities strong. I'm Sarah Kyle with Michigan 211. Our hope is to bridge the gap between the people who need help and the organizations that provide help. Whether it's housing, food, or navigating complex systems, 211 is here to ensure that no one has to navigate their challenges alone. June is Men's Health Month, and today we're tackling a topic that is the foundation of every strong team: mental health. If you're a supervisor, a foreman, a business owner, you know already that your most valuable asset isn't equipment, it's your crew. But a team can't perform at its best if they're carrying a heavy weight that no one can see. I am joined by Randall Harrison, Senior Executive Assistant Deputy Director for the Office of Labor at the Michigan Department of Labor and Economic Opportunity, or LEO. Randall, I can't thank you enough for being here today, and your work at LEO touches the lives of workers across our state. We're so grateful to have your perspective. Do you mind starting with telling us a little bit about your role and how you serve Michiganders?
Yes. As you stated, I am the Senior Executive Assistant Deputy Director here in the LEO Office of Labor. I pretty much, in our normal duties, I assist our Deputy Director of Labor, Sean Egan, with the oversight of our labor agencies, which is the Wage and Hour Division, MIOSHA, Workers' Disability Compensation, and also the Bureau of Employment Relations. So our labor agencies pretty much touch every single worker in the state of Michigan. So I really do want to thank you very much for allowing me the opportunity to have this discussion with you today. But if I can just give you like a quick background of how and why LEO is having this conversation with you today, is back in 2022 during the governor's State of the State address, she noted the need for the state to prioritize mental health due to the shortage of mental health professionals to address the need. So it's pretty much a supply and demand thing. It is definitely not lining up. So our director at LEO tasked our Director of Labor, Sean Egan, to look at mental health in the workplace. And Director Egan, he pretty much convened a diverse work group of industry experts, which is, small business, big business. We had organizational psychologists, clinical psychologists. Everyone was at the table to study workplace mental health challenges and recommend solutions, because as I previously stated, there is a shortage of professionals for the need. So that collaboration pretty much led to the development of a comprehensive report outlining key recommendations for creating healthier and more resilient work environments. And we actually updated that report in December of 25. And it is a great read, but this updated report really focused on, what chronic stress does to the body. And it is a lot of great information. I could definitely forward that to you to share out to your stakeholders, because it is a great read, things that we need to know about stressors that are in our life and how they also affect our body. So we talked about making work environments more resilient. So why does that matter? Because we see that healthier workplaces lead to happier employees, better retention of employees. And I asked that question earlier: who is your best employee? The employee that you retain. And also, last but not least, healthier workplaces equal higher productivity. So to really narrow down your question as to how do we impact workers and why the work that we're doing matters in the workplace mental health space is, first of all, the supply of mental health professionals cannot meet the demand that is needed. when I was in the rabbit hole of searching for my mental health professional years ago, it was very discouraging because I was met with so many people that said that they weren't accepting new clients and just simply professionals that I did not vibe with. And when you're seeking help to assist with whatever you're going through, unfortunately, like, you are vulnerable. You're vulnerable and you need to find someone that makes you feel psychologically safe. So that is the first thing. And then there are different SAMHSA studies that show like 60% of adults with a mental health challenge or an unmet need for mental health services um, uh, also reported costs as being the second reason of them not receiving services that they may need. And then I believe the other stat was about 71% of people felt that they could handle the issue on their own as the main reason of not, seeking help or whatever the case is. So we feel the place where the majority of people spend a majority of their time is the best place to address these needs because another study also said that 65% of workers identify their job as their number one stressor within their lives. So that is pretty much what we're doing right now to impact workers in the state of Michigan and why, this conversation is more important than ever.
And I can hear the passion in your work, and I think it's fabulous, all of the connections that you get to make for the workers here in Michigan. And you touched a little bit on this, that we often talk about physical safety. You talked about myosha being a part of the work you get to do or you get to connect. We are constantly doing our best to ensure people have the right protective gear and the right training, but you're talking about a different kind of safety. Can you talk to me about the focus on mental health and well-being that you see is coming into the state of Michigan? Because you guys are bringing a lot of things here for workers.
Yes. So I am so glad that you asked that question. So under the Office of Labor, we do have our labor agency, which I previously stated is the Michigan Occupational Safety and Health Administration, which they are responsible for enforcing workplace safety and health standards in the labor force. And I think you may know someone that works there that shares your birth date and possibly your face, but that person does a wonderful job educating employees and employers in the state of Michigan about safety and health in the workplace. But we leave the physical safety and health to MIOSHA. So our work focusing on the whole worker or total worker has allowed Leo, I can brag that Leo is the first labor department in the country to be a total worker health affiliate through NIOSH, which is a sub-agency of CDC. So what is total worker health? So total worker health is a NIOSH approach that pretty much expands the traditional physical workplace safety and health to include overall worker well-being. So it recognizes that health is shaped not by not by physical hazards on the job, but also by things that affect the way we feel and work, as far as the size of the workload, job stress, how your work is actually designed, and the conditions in which people work. So total worker health, it pretty much focuses on creating environments that protect workers from harm while also promoting policies, programs, and practices that support mental, physical, and social well-being in the workplace. So in short, MIOSHA is focusing on that. We are focusing on building workplaces where people can be safe, healthy, and able to thrive. So from a physical standpoint, the key is for the worker to go home at the end of their shift the same way they came. And that's pretty much with all their arms, their legs, their fingers, and toes. But when we look at things from a total worker health perspective, we want that environment to be so conducive to everyone's well-being, because we want people to strive for environments that are just so conducive to everyone's well-being, to where it's a healthy space. But we want to take it a step further, and we want workers to go home at the end of their shift better than they arrived to their shift at the beginning.
I can think of very few things that you should brag more about than that. So please never apologize for bragging about the work that you guys get to do, and especially that national just flag of we're doing it, we're trying here in Michigan. And for our audience, I'll mention briefly, I do have an identical twin who works in that atmosphere. So thank you for letting me brag for a minute about my family. Randall, for people, especially in labor-intensive roles, there's still this tough it out stigma. You said people are vulnerable, or they aren't sure where to go. What tools or processes do you have at Leo? What are you using to help flip that script and make sure that mental health maintenance feels just as routine as the morning safety briefing?
Yeah, so I am glad that you brought this particular conversation to the table, because not only in labor intensive roles, but men in general has that tough it out mentality. And I think at some point most people have to have that aha moment where they're like, hey, listen, I'm not being a good person right now. What's going on? But specifically in labor intensive roles, such as the construction trades that you noted, there are some very alarming things going on. The death by suicide rate among construction workers is very high compared to other industries. When you think about the construction trades, those jobs are taxing physically on the body, which results in workers dealing with more injuries. They are definitely engaged in more travel to different jobs. And because they're not guaranteed a job that is 5 minutes away from their house, so they may have to travel far for work. When they're on a job and a job finishes, they really don't know when that next job is going to start. So there's a lack of job stability because, as I previously stated, they're not guaranteed work after that job is completed. So there may be a higher rate of substance abuse. I previously talked about battling injuries, etc. So our labor agency, MIOSHA, has actually done a great job with bringing awareness to all these issues with the labor intensive roles. The second week in September, we do have a construction suicide prevention week, where they hold a number of impactful events aimed at addressing the mental health crisis in those roles. And through our monthly webinars that we do monthly. So we will probably send something out to Sarah to send out for our email updates, where people can sign up, because we do monthly webinars on different topics focused on workplace mental health. And then also there's a tool that we speak very highly of, and is focused on this area. A webinar that we did about, I want to say it was about 1.5 years ago. We did it with the cool people over Man Therapy. And Man Therapy is like such a cool, innovative mental health resource designed specifically for reaching, working age men through like approachable, relatable messaging that is aimed at reducing stigma. And they use humor, they use like straightforward tools to really help men recognize those signs of stress, or, people in those labor intensive jobs, signs of stress, depression, crisis, and it connects them to practical supports that they can use immediately. And we do believe that that is an important tool because it really breaks down those barriers that often prevent men or people in those labor intensive roles from seeking help. The best way I could put it is it offers like a comfortable entry point into these sometimes very uncomfortable conversations that we have to have, and it also provides resources that can ultimately save lives. So when you also think about those roles and the death by suicide rate and et cetera, the age range that we really focus on are the middle age between 35 and 44 years of age. And this is the age, unfortunately, we're living in a sandwich generation. I fall right in this age range. I have very young children and I have an older parent. So we're kind of working both ways, taking care of the child, taking care of the parent, vice versa. And these are the times where people experience their, biggest financial issues, family issues. They may have occupational stressors, injuries. But in this age range, when we look at the death by suicide rate, men are at, I believe it's 35.8 per 100,000 people, and women are at 10.7 per 100,000 people. So you will look at that number and say, wow, men are a lot much higher than women at 35.8 versus 10.7. But those numbers are very tricky because that is the number of death by suicide rate. But the stats show that women actually attempt suicide more. It's just that when men attempt it, they use more lethal means. And that is why that rate is so much higher than women. But this isn't a man thing. This isn't a woman thing, because we have male and female workers in construction. So we do put an emphasis on this, especially in September through our MIOSHA agency. But these are the tools that we really try to get out there. And then we also have a great workplace mental health hub that is associated with our Healthy Mind, Healthy Work initiative. And it has a plethora of resources where we direct people to local resources, national resources, etc.
Randall, number one, I love mantherapy.org. It's one of those websites that I think anyone can find value in. Man, woman, no matter how you identify, I think it's really helpful. And I love that you brought it up because we really have in Michigan, I hope, invested right in making sure that people are safe. When a worker finally does realize they need help, but they don't know where to turn, I would say besides like 988 and 211 education and posters and all the free things and all the ways that we can promote those services and even man therapy, are there any other ways you think that leadership can make it easier to provide clear, actionable pathways for their team members?
Definitely, because that is pretty much our sole purpose of why we're addressing mental health through the workplace, because we're at work most of our time in our lives. We really believe that the workplace is where we need to meet everyone at, because the facts show that people may not get the help that they need on their own. So we do believe that leadership plays like a foundational role in making it easier for workers to seek help when they need it. And that begins with creating a work environment that prioritizes everyone's well-being and intentionally reduces the stigma around mental health. So when leaders openly support mental health, well-being, model healthy behaviors, and communicate that mental health is just as important as physical safety, employees feel comfortable asking for help. So from there, it is very essential that leadership emphasizes a total worker health, not just physical, but ensuring that policies, practices, the day-to-day culture support workers' physical, their mental, and their social well-being. And this includes, offering possibly regular training for supervisors on, you know, recognizing warning signs, responding appropriately, and connecting staff to right supports without judgment. So here in Leo, we actually started having everyone go through mental health first aid training. It does not turn you into a mental health professional, but it gives you the tools to where we've all heard the saying of when you see something, say something. So you just have the tools to, guide someone that may be going through a rough patch, a hard time, to possible resources that they may not have considered if you were not a mental health first aider. So we have been trying to do a lot of things internally because that very first report that I talked to you about that we did in 2022, that work group came up with a few recommendations. And one of the recommendations was to make the state of Michigan a model employer. So we can't be out there preaching things that we're not doing internally. So we are definitely practicing what we're preaching. We are trying to make our environments conducive to everyone's well-being, removing stigmas out the workplace, and just making it comfortable where people can have those conversations if they are going through something. Finally, like making like pathways clear and actionable with leadership means like ensuring that every employee knows where to turn if something is going on. So, this can be done by leadership consistently sharing information about available resources such as 211, for that local community support, and then 988 for immediate mental health or suicide prevention assistance. And integrating these numbers into like a onboarding, safety meetings. Everyone has those internal SharePoint pages, break room materials. I mean, there are so many things that can be done at the leadership level that really, I don't think takes a lot of energy. So when leaders normalize these tools and present them as routine parts of a healthy workplace, workers are far more likely to reach out when they need it. So in addition to the great services that I noted in reference to 211 and 988, working people can also find a plethora of resources that are applicable to everyone in the workplace at our Healthy Work, Healthy Mind Hub. And you can actually visit that at michigan.gov/workplace mental health. Sorry, I had to plug us there.
You should be plugging you. I think that's why we're here. And I'll take what you had said and use a moment to brag about 211 and 988, as you had mentioned, whether you're trained or not. And I love that you guys do mental health first aid training. I love that. Been through many of them. I think it's essential. But at 211 and 988, we are that place that every Michigander can turn to when they're in need, 24 hours a day, 7 days a week. And we see it often. Large number of the folks who are calling us tell us that they have jobs. It's not one of the upfront questions typically, but we know workers call us maybe because they're struggling to pay a utility bill, food is getting scarce in the cupboards. And that financial stress, you had already mentioned what stress does. It's just a symptom though of a larger issue. And that's where we get to step in with families in Michigan to say, what is available for you? When a supervisor or an agency like Leo points folks to 211, we do act as a connector. We can link them to supports that are clear, that are actionable. And I'm very proud of our work. I'm proud of the work that you're doing as well, just as a tax-paying Michigander. Can I ask, is there anything else that you would add? I love that you plugged your own site. I love that you guys have plans. You have webinars. You promote man therapy and 211 and 988. Randall, is there anything else that you would add before we close?
Yes, we are very active and we have something going on each month. So please visit that site. Once again, michigan.gov/workplace mental health. You can sign up for our email updates. You will get access to everything. Before we have a webinar, we send a notification out. After the webinar, we send out slides, a plethora of information, but the site just has so much stuff at the local level and also national level. So please feel free to visit the site and sign up for email updates so you don't miss anything, because we do not plan to become inactive anytime soon.
Randall, I can't thank you enough for joining us today. You have really reminded us that the strongest thing a leader can do is build a culture where it's okay to ask for help. It's okay to raise a red flag. We all know this, but none of us get through this without help of other people. We're in this together. We walk each other home. I mean, we could list quotes probably for the rest of our day, but I'm just thrilled that you're here. I want to let our audience know, if you or someone you know, someone on your crew is struggling, please don't wait for a crisis. Support is just a phone call or a text away. Simply dial 211 or visit our website to find the help in your community. Thank you all for joining us, and we look forward to seeing you on the next episode of From Hello to Help as we continue to connect our community to the resources that matter the most.
We do not